Do you sometimes feel like you're not acting like yourself? Maybe you're suddenly more angry, sad, or confused, even when nothing big has changed in your life. What if I told you that your personality changes might not be just in your head, but could be linked to something happening inside your body? That's where personality change due to another medical condition comes in. Imagine your brain is like a control room for your personality. If something goes wrong in the body, like a brain injury, a hormone imbalance, or even a long-term illness, the control room can get confused. This can make you act or feel totally different than usual. For example, someone who's always been kind and calm might suddenly snap at their family, not because they want to, but because their body is struggling with an unseen problem. So what actually causes big personality shifts like this? Think of it like a car. If the engine has a problem, the car doesn't drive the same way, even if the driver hasn't changed. In humans, medical conditions can mess up the engine of the brain. Common causes include brain injuries like from a fall or accident brain tumors, strokes, epilepsy, or diseases like Alzheimer's or Parkinson's. Even hormone problems like an underactive thyroid can make someone feel sluggish, depressed, or irritable. Infections such as HIV or syphilis, if they affect the brain, can also cause changes. For example, a person with undiagnosed low thyroid might seem lazy or uncaring, but it's not attitude, it's biology. The key point is the personality change isn't chosen, it's a reaction to a physical problem. How do you know if someone, or even you, are experiencing this? Let's play a quick game. Think about your best friend. Now imagine they start acting strange. Maybe they're forgetful, paranoid, super anxious, or just off. They might stop caring about hygiene, seem emotionally flat, or get angry over small things. These aren't just bad habits. Real signs include sudden mood swings, loss of interest in things they once loved, difficulty focusing, strange beliefs, like thinking people are spying on them, or even saying inappropriate things in public. For instance, a polite teacher suddenly cursing in class might not be a meltdown. It could be a brain tumor pressing on behavior control areas. If these changes come on suddenly and are out of character, it's a red flag worth checking. Here's the good news. This condition can be found and treated, but only if doctors look for the real cause. Diagnosis starts with questions. When did the change start? Any head injuries? What other symptoms are there? Then come tests. Brain scans like MRI or CT, blood work to check hormones or infections, and mental health screening. Think of it like detective work. If a scan shows a brain tumor, removing it might bring the person back to their old self. If it's thyroid-related, a simple pill can help. Treatment always targets the root illness first. Therapy can also help the person and family adjust. For example, after a stroke caused mood swings, speech and behavior therapy helped John reconnect with his family and feel more like himself again. Can we stop this from happening? Not always, but we can reduce the risk. It's like wearing a seatbelt. You hope you won't crash, but you're protected just in case. Preventing head injuries by using helmets or seatbelts helps. Managing chronic diseases like diabetes or high blood pressure lowers stroke risk. Regular health checkups can catch hormone or brain issues early. Staying mentally and physically active, like walking, puzzles, or socializing, supports brain health. For example, Mary started yearly physicals after her dad had dementia. During one visit, doctors found her thyroid was slow. Fixing it stopped her depression and confusion before it got worse. Prevention means listening to your body and getting checked before small issues become big ones. Scientists are learning more every day. New brain scans can now show tiny changes in activity linked to personality shifts, even before symptoms get worse. Recent studies found that blood tests might one day help detect brain tumors or Alzheimer's early, just from a small sample. Also, researchers are exploring how gut health affects the brain. Yes, your stomach might affect your mood. For example, a 2023 study showed that patients with chronic inflammation had more irritability, and treating the inflammation helped their mood. Brain-computer interfaces and personalized medicine are also being tested to treat complex cases. The future: faster diagnosis, gentler treatments, and better recovery for people who have been misunderstood for too long.